Are there any questions?
Good job, James. That was
All right.
really good.
Yep. For your microphone, I'm gonna get a golf clap.
I tried to turn the video off to see my video off to see the PowerPoint, so I couldn't see. I didn't know my face wasn't on the thing.
I could see your face.
Okay.
We got your face, Jamie.
Okay.
Well, first of all, I just want to say I'm so excited that you're using the person-centered terminology, individuals with disability or person with cerebral palsy. So many people don't use that, but I'm really so excited that you used it in your presentation and in your paper. So good job on that.
Oh, thanks.
They'll be very happy with you at the master's program because I'm trained to talk like that, so it's good. A couple things I want to mention. One is, and I didn't send you this question, but as you were doing your presentation, I thought about it. Did you see anything in your research about fish tanks and the, I guess in the last 10 years, there's been a lot of research about using fish tanks and colored fish in, assisted living centers and how that has really helped people with dementia. Did you see anything about that?
So I didn't see anything about that, but I've also heard of some of the positive effects that can give. And I think it also goes to like part of the dog assisted therapy for and animal assisted therapy for individuals with autism, that one of those possible treatments was to use the dog in the sensory integration room and things like that. And I think it corresponds to that by giving, something to focus on, a different type of environment. And I think the type of environment that people live in assisted facilities really has an impact on that. So I can see why that would have positive effects. I know in the nursing home that I work in, it's, they want to feel more welcomed. They want it to feel more like a home. And I think it gives sort of that feel.
Right, I think that's true. And just I think the last research study I read was all about the lighting too, like the reflective lighting through the aquarium and through the water, was enhancing the brain stimulation differently than just like looking at the chair next to you. So it's pretty interesting. So one of the things I wanted to ask you is, so you were around when Cooper the cat was around?
I wasn't, but I know there was a cat running. I'm not much of a cat person. So.
Yeah, so I am totally not a cat person, and that's full public disclosure. But Cooper the cat was just around, and Dad, you probably remember, and he just was everywhere. And, would be sitting on the couches or, wandering in and out of offices or, I don't know, in and out of dorm rooms, whatever, the residence halls. So how would you quantify that? Is that animal assisted therapy, or how would you characterize that?
I would say that definitely has therapeutic aspects and therapeutic effects on people, but I wouldn't say that specifically is animal assisted therapy, just because moving forward in this research project, I really had to distinguish between different terminology of therapies because it was hard. There was a lot of inconsistencies and it was murky. And so I kind of boiled down to that in order to be considered animal assisted therapy, it was a goal-oriented, directed by a health or education professional or some sort of service professional. And a lot of it included documentation and towards those goals of the therapy. And so I think that definitely can have positive therapeutic effects, but it's not exactly considered therapy in that way.
Excellent answer. Very good. Thanks. Go ahead. I have more, but go ahead, Thad.
Oh, okay. So, Jamie, I was struck by, well, a couple of photos in there, but that photo of the elderly man in the wheelchair and what looks like an elderly dog as well.
Yeah.
That was interesting to, so I think like we think folks with dementia,
Hmm.
a lot of people might initially think, oh my gosh, how are you going to have this person care for an animal? And what if they forget to feed or do
Yeah.
something, forget to do something?
Hmm.
But that's not really what you're talking about. It's to be a part of their life, to help them.
Yeah. And I mean, there are circumstances for individuals with certain diagnoses where it can be um, planned that they have a routine to take care of an animal, but there are certain conditions that it will not work for as well that have to be addressed. So I think it's really important that the occupational therapist is qualified enough to know when it is safe for the animal, when it's safe for the human, and when it is going to be productive and when it could have bad effects as well. Like dementia may not be the best
Right.
case to be
Right.
completely taking care of an animal, but there are other conditions that it may affect in a positive way.
Yeah, yeah. And I was also, well, and Bree as well, because Mary Bree actually also tackled some stuff about animal assisted therapy from a different angle, from potentially being useful with folks with ADHD,
Uh-huh.
attention issues. But it seems to me, so Jamie and Bree, maybe others as well in the future. So, Jamie, you did a nice job of pointing out some of the problems from an experimental plan standpoint with small sample sizes, folks who are receiving OT. It's for very specific reasons. Everybody's unique in those conditions, but I wonder if going forward, maybe you may find yourself in a position. I don't know how what level this may fit in with an OT actual program you're about to enter, but one way around that might be to just collaborate with other occupational therapists elsewhere, which is so much easier now than it would have been just a short time ago. But and everything, all these kinds of different things that you either have seen that people have attempted to quantify. I mean, everything out there, if we can perceive it, there is a way to somehow put a number on it, right? So even if we're talking about qualitative categories that we rank, so it's difficult, and not always as straightforward as some of the things we're used to in the sciences, but because we can weigh things and we measure the temperature of things, but everything can collect some data on that. So there could be some wide open opportunities for you and anybody, going forward in any of the therapies, I would think.
Yeah. So I have another question. I'll jump in there. So you mentioned a couple of professions who also can use animals in their therapy. Can how broad is it in terms of professionals using animal assisted therapy?
I think it's super broad. Like I said, it can be delivered by an education professional. I mean, I mentioned class pets. It's kind of tricky to decide when that's animal assisted therapy, but you can use it in classrooms as animal assisted therapy. I also think that it's broad in the sense that many forms of counseling may be able to use animal assisted therapy, whether it's mental health or other sorts of counseling. Um, I also, part of it, I read that one of the studies related the effects to a study on individuals diagnosed with HIV and AIDS, and they found that taking care of an animal increased their motivation in forms of therapy like that by owning an animal. So I think there's many places where it can be incorporated. Um, and I know that I kind of took this out of my paper, but there was, when I was going through different forms of animal assisted therapy and describing them, there was some forms of psychotherapy that used animal assisted therapy. Um, I took it out and didn't go that far into it, but I know that's a field that involves it.
Good answer. I do want to comment on your pets for the classroom
Mm-hmm.
stories. My niece is taking zoology,
Mm-hmm.
and they each in the class got cockroaches as their
Okay.
pets. Everyone in the class got their own cockroach. These are the big ones, not the
Mm-hmm.
little ones, the big ones. And they had to take care of their cockroach
Oh
pets
gosh.
uh, the duration of that semester.
Mm-hmm.
So yeah, I'm not really all about that.
Yeah, that's, it wouldn't really be, well, like I said, I guess it's it's for more people, some people more than others. That wouldn't really be my thing.
The teacher, she was a zoologist. She was totally into it. I mean, she was like, "Wow!"
Oh man.
Yeah. So, you know, be happy Thad isn't giving you
Cockroaches.
as pets to keep for the whole semester.
He's got ideas now.
Yeah.
Oh boy.
Jamie, you mentioned about not what, like wondering when does something become recognized as therapy. So if some family members go through, as a result of various things, with different types of therapies, and what I remember about some of those things, because if you're a loved one's advocate, you're paying a lot more attention, right?
Right.
Somebody needs that. So to me, I remember the therapists, and I was so happy with all their performances. So, which was great because that's what we needed. Is they made a point of trying to identify particular objectives, right? They had a goal in mind and develop a program. So in my head, that was really kind of defined therapy is it's you are trying to get a person to where they can perform a particular task up to some level, or all the way back to normalcy.
Right. Yeah. Yeah, that definitely helps to like describe it in that way. Because sometimes it gets like misconstrued too as things like that, and that's a pretty straightforward, set. You either have an objective or it's just, I mean, it can be for therapeutic purposes and not be therapy, but
yeah, therapeutic. I know you said about Cooper the cat. So I remember more than once I went from telling students, Cooper needs to be outside. He can't be in the building. Right. It's not safe for the cat. It's not safe for us. And I remember, one time maybe it was one of these weeks. It was the third time that week I told students, take the cat out, and I waded into him a little more stronger than they. But what a lot of people don't, if they don't have anybody in their family who has a significant allergy to pet dander, they don't get how important that can be in a real hurry.
Yeah.
And that's something that I think frustrates a lot of people, like when they see, people with, therapy animals is, it's great for that person. But if that person is not being cognizant of, bringing that animal into enclosed spaces where people had no reason to think there was going to be a dog all of a sudden being in there, or somebody's carrying their cat or whatever.
Right.
It's addressed.
Yeah.
So how do you see yourself incorporating this into your career?
I'm not sure yet because I don't want to say I'm pretty indecisive, but I'm a pretty like, oh, maybe I'll do this, maybe I'll do that. So I'm going to OT school, and my thing is that I've shadowed in a few different OT settings, but I haven't actually experienced like witnessed in person the animal assisted therapy. I've done a little like with the therapeutic riding and volunteering and stuff, but not specifically hippotherapy. So I want, like, one of my field works I would really, really like to be in the hippotherapy field, and just to really determine if that's something I do want to do. I also like with occupational therapy that I can go work in one age setting for a while, and if I decide after a while like, oh, I want to switch it up and go back, you can go work with kids and stuff. So I like that Lemoyne gives you a really a big picture of it all, so that you can kind of make those decisions in the future. But
so we had a student who graduated, maybe it's 4 years ago now, and she went on and went to OT school in Florida, and she is now a traveling OT.
Yeah.
So she had 4 months stint in Hawaii.
Oh, wow.
And she had 4 months in Arizona. And then I don't know where she went for the next 4 months, but it was amazing. I mean, it was really, really good for her. She loved it.
Yeah. I mean, I always wanted to do, I knew I always wanted to do something like in the healthcare field. And I, for a while, I wanted to, be able to go travel places and help people too. So I love that and kind of your options are like limitless. So
yeah, she got paid well, so she really, really liked it. Yeah.
That's awesome.
Yeah. I'm good. I'm good with my questions.
Questions from the rest of the peanut gallery here, students? Bree?
I have a question. So I noticed that you had like a lot. Did you have more studies on child therapy, like with animal assisted therapy, or did you have like a mixture of both, like adult and child?
There was kind of a mixture of both. I think I found that the ones on children were not a little more in depth, but they were just better studies based on their like experimental concepts and things like that. Um, I think I also talked about them a little more in this than some of the other studies I reviewed, just because those were first in my paper.
Mm,
And then I kind of, I don't want to say like a matter of time and stuff, but I found them all to be like those had more quantifiable like data in their results than some of the other ones did.
mhm,
I think some of the studies too with elderly patients and in the nursing homes and with cases of dementia, those are much more harder experiments to carry out just based off of some more safety concerns and things like that. So I think I focused more on the children's studies, but I had a lot of other studies too.
since you like focus more on the child studies, does that mean that maybe you saw there was more effects of animal assisted therapy on children compared to adults? Like
I think the
there was
cases,
more of an improvement in different things.
yeah, I think the cases that had more effects were for certain diagnoses and stuff that they have more research on those at the time. I don't think it means necessarily that there's more effects. I just think there's more that's known about it right now. But I do think there's definitely populations that are affected more, but it's hard to tell because it's so different for each person. And like one other study said that individuals with mental illnesses experience the most greatest effects from animal assisted therapy. So it's really hard to tell because it's so circumstantial. But I think it's just there's more research on um, children and hippotherapy from what I found personally, at least.
I have a question. Um, so in yours, I thought you did a good job like addressing the concerns and like the negatives, which is something I didn't do in my paper. But did you end up finding any like solutions to those concerns, like allergies
Mhm.
and like other
Um,
things like that?
I think a lot of the solutions just depend on the setting it's involved in, and I think it depends on those people specifically that are undergoing animal assisted therapy. Like there was when I interviewed at one OT school, it was a group interview and there was a girl that was talking about she was an occupational therapy assistant, and she had done work in another state for women who had been incarcerated, and they were diagnosed with mental illnesses, and so they were all put into a home to live in together, and the occupational therapists had to go in and find activities for them to do, keep them occupied and things like that, and work on their therapies. And so one of the things that she tried to do was she tried to bring in um, and do a study on bringing a therapy dog in. And a lot of the patients saw really good effects. They were really responding really well to it. And the majority of the house really was doing well. But there was one particular patient who, the woman said that she had kind of reservations to dogs. Like, I don't know if she was a little afraid of dogs or what it was, but she just didn't respond the best to it. And because they were all living in the same house, she felt that it wasn't appropriate to continue the dog therapy moving forward because that person specifically, her quality of life was being affected, even in a little way. So I think it's important to consider that moving forward is that even though she stopped that particular therapy, um, the professionals that were interviewing us said that even though she stopped it, it doesn't mean that that can't be used in a different setting moving forward. So I think all of it is based on the individuals involved. I think that's kind of how you get around it is you assess specifically for that individual. Is it helping that individual? And in some group settings, it based on allergies, it might just not be able to work. If there's an individual in a facility that has an allergy, you may not be able to conduct therapy there. There may be options to conducting therapy in a separate place.
I have a question. Were you able to find whether or not animal-assisted therapy affected kids more than adults?
I think it's kind of really just circumstantial. I think that there was more research on. I found there was more effects in the research on kids because the data was more straightforward and done in some of those studies based on hippotherapy and things like that. But I think it just depends on the individual, and because the sample sizes are so small right now, because it is so focused on the individual, it's really hard to tell who is benefiting the most because it's different for everybody.
And there's also way more kids getting OT in school districts, and you have a lot more access to kids than adults. So I can see that there would be more kids studies just because you have every public school in the United States has an OT. So, well, maybe there's some state, not sure. It's supposed to be OTs in every public school. So you have a lot of kids. Yeah.
I have an experimental design question. So Jamie,
okay.
But maybe Mary used to come across it. So my wheels are kind of turning. I am paying attention, but my wheels are kind of turning. Like, how could you test this? So if we don't have, and this would just, you would not want to have to take like a group of 5 kids. Let's say they're young people. They're all dealing with some same condition, right? We don't want to have to say, oh, you 5, we're going to be our control group. We're not going to bring the dog in to help with therapy. We wouldn't tell them that, but that would be like a missed opportunity. Unfair. That would but what if you, with an individual, if it was somebody who was you were working with every day, Jamie, so, and you're working towards achievement of some particular task, and you're working on this every day, and I can't come up with an example, but what if you had the dog there every other day, right? Like, or randomize when the animal is there and could quantify how well things went on that particular day. So then, I mean, you're not controlling for time, but you would potentially,
That's a really good option, because if I go back to, there's a photo, is it that one, or I think it's this photo. I believe, this is a photo that I actually found from a YouTube video, and the man's name is Hank, actually, and his therapy was incorporated with the dog on Tuesdays. So he had therapy the other days, but the dog was brought in on Tuesdays. And this wasn't a study, this was just a YouTube video based on this man's therapy, and based on animal assisted therapy. And the person conducting the therapy found that he, the man was very excited to see the dog again. And he was like, oh, I don't remember the dog's name, but he was like, when's the dog coming back? And she'd be like, oh, he's coming Tuesday. And he decided that it was really motivating for him, because he decided that he wanted to be able to walk the dog. And so on his other days, that was his motivation to practice walking farther, is that on Tuesday he was going to come in and show the dog so that he was walking and that he could take him for further of a walk. So I think that's something that could really be incorporated into studies as well too, is that maybe animal assisted therapy doesn't have to be the only aspect of the person's occupational therapy treatment, but it can provide many other effects. Like many of the studies said, is that OT specifically, and OT theory has to really, really be prominent as well in itself.
All right, any other questions?
Not for me.
All right, well, we beat the record set on Monday for lengthy Q&A, but
I always talk too long too.
Well, it was interesting. It's really an interesting topic.
I turned off my video because, and And if you caught me looking at my phone there, Jamie, while you were talking, that's because
Oh, I didn't.
Cassidy shot me a text that her audio was really broken up, and then when she turned her video off, she could hear. And so the audio was breaking up just a little bit, so I turned my video off. It seemed to help. It wasn't too bad, but
yeah.
Yeah, but when I had it off and I was just focused in on, I really enjoy this. I'm just, these capstone presentations. It's just like I can be a student and learn something. Right.
Yeah. It was really good, Jamie. You did a good job.
Thank you.
Good job, Jamie.
Good.
Thanks. All right.
Okay, so we are, let's see,